Well, we're going to get started.
Where's the fireplace?
I don't know. We need one though for you. Our speaker today is a physical therapist named Jessica Rayder, and she comes to us from the same place that you had the osteoporosis and posture, the Aquatic physical therapy done. She's going to talk today about chronic pain management and how to reduce your risk for falls through pain management. So, anybody in here have pain?
Yeah.
I do. So, yeah, pain. Pain. Oh, well, maybe she can tell.
That was last session. That's what we'll talk about today.
But we do have a lot of great presentations, so I'm very glad that you all are here today. I hope you come back next Wednesday. We have somebody coming in to talk about home safety and home modifications. Then we have somebody talking about vision and how it impacts your risk for falls. And then we end January with somebody that's going to talk about behavior change. Who likes to make changes? Yeah. So let's pay attention and enjoy this presentation.
All right. Hi, everyone. I'm Jessie. Just like she was saying, I work at Aquatic Physical Therapy in North Raleigh. That's also where Christy, your presentation at the end of December, she comes from there as well. So she talked about osteoarthritis and posture. I'm going to talk about chronic pain management in relation to arthritis. So if you guys have any questions, let me know, but we can also take questions at the end, but anything you want to know. All right, so this is just kind of an overview of what we're going to be talking about today, which is just chronic pain, arthritis, and how that impacts your fall risk. All right, a little bit about me. I'm from Northern Virginia. Anyone from Northern Virginia? Or is everyone from, where from Northern Virginia?
Springfield?
Okay, very nice. Fairfax. Love it. Everyone else is native.
Where are you from?
Fairfax, Virginia?
Oh, Fairfax.
Yeah. Where the snow is right now. Very nice. So I went to school all in Virginia. I went to James Madison for my undergrad and Mary Baldwin for my graduate. I specialize in integrative pain science, cognitive behavioral therapy, which you guys will be talking about at the end of the month, and dry needling. Have any of you dry needling? It's some people. Yeah, it's very effective. Has anyone done physical therapy before? Yeah. Okay, love it. So you guys will have an idea of what we're talking about today. I'm very active. I like to play in all different kinds of sports, and I especially run after that cute little guy right there, my little pitty. He keeps me active as ever.
Reggie's his name?
Reggie. He's a little cutie. Okay, so what we're going to kind of glance over today, because pain is so diverse. There's so many avenues of it, and there's different realms and care for it. But chronic pain as a whole has three main categories. So you have your symptomatic pain, your nerve pain, and your systematic pain. Okay? A lot of us all probably fall in different avenues of these categories. You've probably experienced different injuries or conditions throughout your life that you've fallen into any of these categories. For osteoarthritis, that's more of the symptomatic pain. It's that bone spur, little bone formation inside your joints that cause that catching pain, that sharp pain, aching pain around all of your joints from muscle tension, a lot of joint swelling. So that's where you have more of your osteoarthritis, the falls where you have fractures, any sprains. And that kind of pain tends to respond best to the PRICE protocol. Does anyone know what the PRICE protocol is?
No, but it sounds expensive.
It's actually the cheapest form of therapy we have. PRICE protocol is protection, rest, ice, compression, and elevate. So when you're having tissue, so muscle or your tendons or your bones injured from bone spur or any kind of osteoarthritis formation, if you fall, injure yourself, if you bump your hip on the table. Yeah.
I'm slow. Can you do the PRIC?
Yeah. So the P is protection, and then the R is rest.
Well, it is not tell my wife that?
Yeah, I is ice. C is compression. And E is elevate. That for
E is what?
elevation. So when you put your leg up or you put your arm up over your heart. That form of pain responds best to ice. It helps calm down the inflammation in that area. I bet if any of you have osteoarthritis in any of your joints, ice to that area helps kind of quiet down the pain or the aching that you're feeling. If you lift your leg up or kind of lay back in a recliner, it helps to kind of calm down that pain in that area, reduce some of the swelling in the area, especially if you have any compression sleeves or any compression pumps. That can help flush the swelling out of that area and calm it down to a manageable level. Unfortunately, for a physical therapist, I can't fix your osteoarthritis. I can't go in there and shave off the bone. That's what the surgeon would do. But what we can do in PT is strengthen the muscles around it, make sure that you stay mobile, and make sure that you stay safe. Because if you have a lot of swelling in a joint, your brain doesn't really connect with that area and it makes it more unstable and you're more likely to buckle or fall when you're walking on those areas.
What do you mean by protection?
Protection is just so if you were to bump your knee or if you have osteoarthritis and you tweak your knee and it has some inflammation for a week or two, just kind of coming off of that leg gently or not doing anything that would increase your risk of further injury. Okay, so that's the symptomatic pain. This is more the most common pain that most of us feel throughout our lives and with osteoarthritis. Then you have nerve pain. So that is some kind of damage or dysfunction to your nervous system. And that is when you feel that burning, tingling, shooting, numbness, loss of sensation pain. That's more of your rheumatoid arthritis, your diabetic neuropathy. So when you have loss of sensation in the bottom of your feet and your hands and your fingers, gout and shingles.
I'm single.
You talk about your wife all the time. This nerve pain and what we feel with rheumatoid arthritis versus osteo, rheumatoid is usually in both sides of the body. So it's in both your hands, both your wrists, both your elbows. It's usually in the upper body. It can be in your lower body as well. If osteoarthritis is just tissue and bone, it's usually just the right knee. It could be both knees, but one's usually worse with the formation of those bone spurs. With rheumatoid arthritis, you get it bilaterally because it's your nervous system from your brain to your spinal cord and you feel it on both sides. So you have inflammation response and swelling and pain present on both sides of your body just because your spinal cord is being activated more with that condition. Especially with any kind of neuropathy, that's those nerves starting to lose their signaling function. So then you have that loss of sensation. That's where a lot of people will have slipping or falling or tripping because they can't feel the ground underneath them. Or if they're in big shoes, like if you were to wear big Hoka shoes and you don't have that sensation in your feet, you're more likely to feel like you're on a boat or on a cloud and you kind of feel like you're rocking because you don't have that sensation because those nerves stop working because they're a little bit more damaged in those areas. Nerve pain, unlike symptomatic pain, responds better to heat. So if you're to put an ice pack on someone who has rheumatoid arthritis, any kind of neuropathy, putting ice in that area can make it feel like it's burning, or it can make it feel like you have a really, really tight tourniquet or glove on that area, and it almost makes their sensation worse because if you put cold on a nerve, it shuts the nerve off more. If you put heat on a nerve, it allows that nerve to expand and accept more signaling, and it starts to feel better. So think of if you have any kind of nervous system dysfunction, your nerve starts to shrink. If I am trying to get that nerve to accept more signaling, I need to heat it up. And I need to make sure that it stays nice and warm, and then it can accept more signaling and you feel better. Has anyone ever heard of red light therapy or infrared therapy?
Yeah. And I'm glad you did this because I was thinking about, because people have talked about it, I've seen them do it, but I'm osteoarthritis. Sounds like red light is not for me.
So red light is good for osteoarthritis in the sense of, so at our clinic, we have a cold light laser. That does red light, but it does cold red light and hot red light. So cold red light will help with that osteoarthritis pain and calming down the joint inflammation and calming down signaling to that area. Red light therapy is really beneficial for nerve pain because it helps to heat up the tissue in that area. It promotes more blood flow, allows for better signaling. We do use it a lot for our patients with neuropathy in their feet and their hands and have really good response. So if no one's used red light therapy, it is something that I would recommend you looking into and seeing if it's something that would benefit you as well. With nerve pain, there's also different types of medication that can help. Gabapentin is a common one. You would have to talk to your neurologist or your physician of what works best for you with your conditions, but medication helps more with nerve pain, again, calming down the signaling from your brain to your body. And then sensation therapy. If you have something really hypersensitive, if you feel like you can't touch an area and it has a lot of pain with light touch or water or the clothes that you're wearing, some people struggle with that. We do sensation therapy, which helps to kind of retrain that area of your body through different textures and different pressures.
I would also tell people, I was at a veterans thing and a lady brought some type of red light therapy, and it actually helped. Some of these people, I was surprised, they said it really helped them. I'm assuming they must have had nerve pain.
Yes, they would likely have nerve pain.
I kind of dismissed it, and I think it worked.
Yeah, I know.
They actually said it worked.
I would recommend looking into it if it's something that you've heard. We use it daily in our clinic, and we have really good benefits from it. But again, you can always talk to your doctor if you have more questions, or come see a physical therapist, and we can trial some sessions and see how you feel with it. And then the last one is your symptomatic or systematic pain. This is more of the chronic pain in the sense of the fibromyalgia, psoriatic arthritis, more autoimmune conditions or chronic illnesses that people can undergo. This is when you're having a central dysfunction. So there's a injury or a disconnect between brain, spinal cord, muscle, and tissue. So multiple parts are being played into. If this is tissue and bone, and this is your nervous system, this is a combination of all of that together. So it takes more personalized care to kind of work through and find out what will work best for you. But that's usually presents as widespread pain from head to toe, hypersensitivity all over, swelling in multiple joints at multiple times for a prolonged amount of time, weeks to months on end, and a lot of histamine or inflammation response, so redness, swelling, things like that. Yes?
Marlene won't let me talk during class, so I'm talking now. NOCI. Never heard of a NOCI.
Nociceptive, yeah. Nociceptive just means pain.
Huh?
Nociceptive is a pain receptor. Those are the medical terms. That's why we put the easier terms there.
I thought nociceptive, I'm getting that confused with the word for the little nerves that keep your balance.
Proprioceptive. Yeah, and we'll talk about that. That was a good thing to bring up. So for more of the chronic pain that you feel, that's where you really would benefit most from pain management. So seeing a pain specialist in the area, undergoing cognitive behavioral therapy, which is great that you guys are trying that in a month's time. So if this is something that you experience on a more frequent basis, I would recommend attending that session in about a month so you can learn more in depth. We don't have all the time to talk about it here, but people do really benefit from that cognitive behavioral therapy. And then parasympathetic training, it just means calming down the nervous system. So promoting rest and digest throughout your day to help calm down signaling of your nerves. Does anyone have any questions about the three main areas? Yes. No, yeah. You can take as many pictures as you want. And then I think it's being recorded. I don't know if they can go back and see it too.
It'll be on our YouTube channel.
Oh, on the YouTube channel. Perfect. So you guys can go back and watch this and learn everything again too. Okay. So that is chronic pain at a glance. Yeah. No, you're good.
Going back a little bit, gout, is that preventable? Is that curable? Or is it a life sentence?
Those are three big distinctions. Gout it can be more hereditary. So there's different populations and cultures that are more prone to having gout. There's different forms of gout, gout in the toe and gout in the knee. Gout is treatable. You just would have to make sure that you're being compliant with the care that you give. Because a lot of people get an episode of gout, they treat it, and then they forget about it for years on end, and then 3 years later it comes back. Or a couple months later it comes back because they stopped doing what was effective.
It has
But
something to do with diet, doesn't it, or is that old news?
it can have something to do with diet, but there are many reasons of why someone could have gout. But I would definitely talk to your doctor or come see a physical therapist, and we can assess how chronic it is and what would be the best plan of care. But it's not a life sentence. That's a big, that's a big term. All right, so for today, we're just gonna talk about arthritic pain, specifically the osteoarthritis and the rheumatoid. So the symptomatic pain and the nerve pain. Okay, so for your osteoarthritis, we see that nociceptive pain again. That is your symptomatic pain. It's tissue inflammation, injury to your bone or to your joint, and it can be traumatic or non-traumatic. So it can be from wear and tear. If you were an athlete when you were younger, if you had a heavy labor job where you were lifting stuff and doing high mechanic things, or it can be traumatic if you have a fall or anything like that. If you're involved in a motor vehicle accident, all of these things can cause osteoarthritis to be more prevalent in certain joints and certain areas. Again, it's that localized pain. It's sharp, it's aching, it's catching. It's usually in a right knee, an elbow, a finger. You can have it on both sides, but one side's usually a lot more effective. And it's really just that joint inflammation and pain. And then, I don't know if you, this picture just kind of goes through some of the things that you would feel if you have osteoarthritis. So reduced mobility, flexibility, you have that bone spurs, those sharp pains, pain in your joints instead of like pain in the muscle belly.
Your back joints or just
You can have arthritis in your vertebrae in your back. Stiffness overall, asymmetry, meaning you have it on one side, not the other. Yes?
Is heat helpful in that situation with the joints? Heat.
So if you have more of the osteoarthritis, ice is usually a little bit better, or cold packs. If you have more of the rheumatoid, heat is a little bit better. But if you've had osteoarthritis for 30 plus years, 20 plus years, we have found that people do like heat for that regard, because it's usually helps to, when you have osteoarthritis, it locks up a joint, makes it really stiff, and that makes the tendons and the muscles around that joint stiff, and they don't move as much because you're not moving that area of the body as much, not accepting weight onto that area of the body. So it makes everything around it stiff, and we found that heat helps to reduce the tension around. So it helps to relax the muscle that's tight around the joint itself. But the joint itself responds better to heat, ice instead of heat. Did that answer your question?
I would think, okay, heat is much better, but the ice, by having the arthritis, isn't it, I would think the ice is worse for it?
No.
No?
No. You also have to think that everyone is different. So people respond to ice and heat very differently. This is just the rule of thumb, or textbook we'll call it, is if you have joint pain that's bone or tissue, ice. If you have nerve pain that's causing inflammation to an area, heat usually responds better. But in reality, it's more what responds best to you. If you like heat and your body responds to heat, keep using heat. But that's where we'll also go into other things that will help besides heat and ice. I know people can get a little stuck on what to use, and it's just what's effective. This is all the textbook of what should be helping you, and then we'll get into more of the movement and some exercises we'll go over in a minute to go through that, okay? So again, just the textbook of osteoarthritis. Main thing is you want to see your orthopedic physician. You want someone to ask questions to, monitor your care, make sure everything's going well. If you need any kind of injection or anything like that, they're the ones to kind of go to, or potential surgeries for a joint replacement. Again, with that price protocol to help with structural inflammation, again, that tissue bone inflammation. And then this is where we come in. So the main thing with osteoarthritis is making sure you see a physical therapist, because when you're in pain, you don't move as much. We come in and we educate you on what's going on. We help promote you to move with less pain and make you more mobile and safe. and will help treat the condition so we hopefully reduce the progression of it or just make your experience in that moment a little bit easier. So we will help with that daily movement to counter your stiffness when you wake up and it feels like your body's all locked up. Make sure that you can maintain as much functional mobility as you need to get around house chores, go out, hang out with your friends, get around the neighborhood, anything like that. We do a lot of skilled strength training to make sure that we are strengthening the muscles around your knee, because again, if you're not putting weight on a leg or on an arm, those muscles that are around it are going to get really weak, and then that will cause other difficulties down the line. So we want to make sure that we're strengthening those properly, but not doing it where we're causing more pain into that knee, because we want to make you as strong as possible just to keep you doing whatever you would like to be doing in your day. And then learning activity modifications, because again, I can't fix your arthritis. That would be the surgeon going in there and cleaning it up, but I can teach you how to sit differently in your chair, change routines throughout your day, sleeping positions to help reduce pain when you wake up. We go through your day-to-day movements and day-to-day activities and see where we can just adjust them briefly so that you can tolerate whatever you need to be doing for the length that you want to be doing it. And so you don't feel like you just can't do this anymore. We can come in and teach you how to do it with little modifications or changes so you can still get done what you need to get done. And then fall risk management, which we'll go over in a minute. But that is the big one, is any kind of osteoarthritis, you have a great percent chance of having any kind of, which is why you guys are all here today. And we'll go over that in 1 minute. All right, before we go on to rheumatoid, anything about osteo? Okay, rheumatoid arthritis. Again, you have that neuropathic pain, so the nerve pain. Something in your nervous system is damaged or not working properly as it should. So you have that burning, tingling, shooting, numbness, that altered proprioception. So proprioception is your joint's ability to tell where it is in space. If I had my hand out here and I turned my thumb down, if I didn't have all proprioception in that joint, I couldn't tell you where my hand was right now. I'd think it's over there. Versus I can tell it's to the right side of my body and my thumb's pointing down. Or if I were to put weight onto my knee, I'd feel like I'm standing on a cloud or a cushion, versus if I had that proprioception in my knee, I know that I'm putting weight onto my right to go to my left. And that's where we lose that proprioception in our knees with any kind of arthritis, and we have that fall where it feels like you're buckling, your knee gives out, or you just got up and you fell down and you don't know what happened. Because it's that loss in connection between mind and joint. These are some things that come with rheumatoid arthritis to just kind of monitor. So more of that disturbed sleep, fatigue, it can change your mood, just because with rheumatoid it's more chronic, it's bilateral, so you're feeling it more intensely throughout the day, so it can impact your mood changes, it can impact your sleep quality. You can have some weight loss, joint swelling on both sides, especially in the fingers and the toes and your wrist. It can change the skin in that area, so it can make it less colorful, and meaning it's more white, or it can make it more purple with all that swelling. So you might notice some change in sensation or change in color in those areas, and it can make it numb, where you feel like you can't pick up pennies, turn jars, button clothes, because you don't have that sensation in those fingertips anymore. And that's where we'll come in for PT. So again, you want to make sure that you're seeing a rheumatologist or any kind of physician, that if you have a primary care physician, someone that can help monitor your care, guide you to the right medical needs that you potentially want to seek. Mm-hmm.
Can you have both?
Yeah, you can have both.
Osteo and rheumatoid.
Yes, so you can have both. Any kind of medical practitioner that you have in the area that you want to follow with. And then again, with nerve pain, you want that heat, compression, and any kind of massage. So all that deep tissue work can help shut off nerve activation. A compression sleeve or a glove can help with shutting off swelling in that area, nerve response in that area, and heat again helps best with that nerve inflammation. And then with physical therapy, that's where we would come in to help with promoting the deregulation of your nervous system. So rest and digest. A lot of times our nervous system lives in what's called fight and flight, or fight and flight. And we want to put it into rest and digest, so it doesn't feel like you always have to be alert and always be on. Again, we were doing strength and mobility care for anyone that has osteoarthritis or rheumatoid arthritis, activity modifications to get through your day, and then the big one today, which is fall risk. Okay? All right. So when it comes to fall risk, the Arthritis Foundation has conducted multiple clinical trials and studies, and this was their big finding, which is if you have one lower joint that's affected by osteoarthritis, or any kind of arthritis, truthfully, you have a 53% chance of falling, greater than anyone that does not have arthritis in their knees and their ankles and their hips. If you have two joints affected, your percentage and risk goes up to 74%. And if you have three or more, it goes up to 85%, meaning it's more likely not in if you fall, but a when we get up to this. So this is where training, awareness, and making sure that you are taking the necessary steps now instead of after you fall is really crucial for reducing injury when it potentially happens, as just we get older and our bodies start to have pain and a little bit more of that dysfunction in our everyday. Okay. So how do we reduce your fall risk? I know you guys have been taking, you did 8 weeks, right? Or of the class so far?
We've done 3 months.
3 months. Okay, beautiful. And you guys have learned a lot of exercise and training. So you guys are already on the right steps and the right path to helping reduce your fall risk, is getting educated, moving your body, and training your body now versus after we have some of those bigger falls. So first things first is you get a fall assessment. That could be from a physical therapist, your doctor, anyone that can do any kind of functional testing on you to see how well you're able to get up from a chair, walk around while someone's talking to you, negotiate over curbs or grass, and you guys have all likely undergone any fall assessment at this time, which is what brings you into here. Monitor your medication, especially being mindful of pain relievers. So making sure that your medication is the correct dosage for you. You're not undertaking your medication or overtaking your medication, because that can lead to fainting or any kind of cognitive changes that may lessen your awareness when you're out and about and may put you at a higher risk for putting yourself in a situation for a fall. And pain relievers, if we take too much of them, it can distort our pain signaling and we feel nothing or we feel great and we go until our body gives up, when you just weren't getting those signals to kind of sit down, take a rest, because it got distorted by some of those pain relievers. Fall-proof your environment, which is what you'll be learning next week. Reducing any tripping hazards, rugs, loose doormats, anything on the floor, toys if your grandkids have toys, or if you have any pets, making sure that they're not small and running around and they're going to trip you. Grab bars in your shower, in your bathroom, wherever you may need them around your house, just for assistance to hold on to while you're making those big movements, getting up or changing, and then making sure it's well lit in your home. A lot of times, a lot of falls happen at night or in the dusk hours where the sun starts to go down and we lose some of that vision. So you guys will be learning more about that next week, which will be great. Exercise, which is what I'm here for today, is to see your physical therapist for personalized care. And we'll go over that in one sec. And then some other big hitters are, you need to make sure you're wearing proper footwear. So avoid excessive shock absorption. I know there was that big craze of everyone wanted Hokas because they feel so good and they're so cushioned and they feel like you're walking on air. But for someone that doesn't have proprioception or the necessary strength and stability in their joints, that's more of a hazard for you, because you don't have that control and it feels like you're walking on a cushion or a mat and it's not giving you that stability and feedback from the floor or from the gravel or from the asphalt. You would need to go see a physical therapist, or even Fleet Feet has really educated personnel that can go and do a foot assessment for you to see what shoe would give you the best feedback and support for your ankle and allow you to still ground yourself to the floor without feeling like you're walking on that cushion. And then we also have utilizing your proper assistive devices, which again, you guys are doing, I think next week as well, or in the coming weeks, we're working with assistive devices. So making sure you're using the right cane at the right height, you're using or have rollators or walkers and wheelchairs at your house as you need. If you know that you're gonna be walking around the mall for a long amount of time, bringing something with you just in case someone bumps into you or you get tired with 30 minutes into that walking. So that'll be something to look forward to in the next coming weeks, is trying out different assistive devices and seeing what would work best for you.
What does DME?
So DME is durable medical equipment. It just basically means an assisted device. So canes, walkers, any kind of aids that we may need. And then the last one is managing daily pain levels. So be proactive and plan ahead. On today, it's almost snowing, it's freezing cold. We know that our joints are gonna be a lot more locked up and stiff. So making sure you're starting your morning by doing some morning stretches, which we'll go over in a minute. Either taking a hot shower or a hot bath, if that works best for you. If you have a TENS unit and you find that that kind of helps calm down your nervous signaling, if that's what you need, using that in the morning so that you're more mobile, your nervous system is calmed down, and you're having less muscle tension and pain starting out your day so that you feel better going into walking around doing your exercises instead of just trying to push through pain and stiffness all day long and hope it gets better. So being proactive is very important in optimizing your day and starting your day out safer, not just waiting for something to change. You have to kind of set those routines to help change your day. All right. So how do we be proactive? All right, we go over, there's morning stretches in the bed that you can do to just loosen up your back, loosen up your knees, loosen up your hips. Because when we sleep, you're usually sleeping 2-3+ hours at a time, and your joints can get really stiff, your muscles can get locked up. So you don't wanna go from being completely in a dead sleep and then just trying to get up and move, because nothing's waken up yet and you're trying to move on sleeping structures. So we wanna make sure you allow about 2 to 5 minutes before you get up just to move your body, warm up those muscles, wake up those joints to kind of flush out sleep. If you have a lot of diffuse pain, if you feel like your symptoms are more nerve related, doing belly breathing. And we are gonna do some belly breathing here today. Before you get out of bed. Belly breathing is a way to help promote oxygen intake into your lungs, and it helps to calm down your cortisol level. So cortisol is stress, activates your nervous system. Belly breathing will come in and calm it down. So that again, you start out your day at a lower level of activation and pain response, just to try to help manage stress and pain before you start your day. Or if you are having a really bad day, if it's really hot or if it's really cold and you feel like it's gonna be a rough day for you, if you're gonna have a flare, using a hot pack or a cold pack to help reduce pain in necessary areas that you may have before you get out of bed, and not again just pushing through and using it at the end of the day. So trying to start your day out with calming down some muscle soreness with a hot pack or calming down inflammation with a cold pack. Compression sleeves and braces if you have a really unstable joint, or if you have a lot of swelling in a knee or in an elbow. If you've ever been prescribed a compression sleeve, trying to put that on if you feel like you're having a flare before you start your day. Or if you're gonna be walking a lot, doing a lot of activity, putting on a knee brace if that's something that you own and has been prescribed to you. Trying to put it on before you do your walk and not after, when there's likely more pain and swelling in that area. Just again, setting your body up for success and giving it the support that it needs so that everything is stable when you're doing high level activities.
Did you make some kind of compression thing for the hip? My problem with my hip, right hip. I've got like a back thing, and I've seen the knee thing, and I've seen the wrist thing.
So there's different, hip is a little weird. There's different forms of compression dressings and braces. There's hip belts called an SI belt, but I wouldn't go buying them without seeing either your doctor or a physical therapist first so that we can assess and see if it's useful, because we have all of the tools at our clinic. So we will I'll put them on a patient and see, hey, is this effective? You're having a great response. All right, I think you should look into purchasing this for yourself. This is the brand you want, this is the make you want, and then this is how you're gonna put it on, take it off, and these are the environments that you're going to use it. So again, seeking a specialist to help educate you on what to buy, when to buy, and how to put it on correctly. If you're feeling really stiff and achy, a lot of times with any kind of arthritis, what our patients will find is that they'll come in and think that they can't do anything and they're in a lot of pain because their knee or their hip just doesn't want to move and it's been stiff all day. And then when we start promoting light movement through exercise and stretching, their pain starts to go away and they feel better and they leave standing more upright, they leave feeling better. Because a lot of times that pain that you're feeling from some arthritis is just immobility. It's painful, you don't move it, and then it gets more painful because you're not moving it. So we come in and we try to show you ways to promote that mobility gently, get some movement in those areas, and it helps to flush out that pain that you're feeling. So I set up some home exercises for you that we'll go over in a minute they're light activation exercises to just promote mobility, not cause strain and pain, for you to utilize throughout your day, or when you feel like you may need a little bit more movement if you've been sitting down for too long, or if you've woken up and you just feel like you can't move, it helps to move your body a little bit more. Some of our patients use timers, or they'll say at 2 p.m. every day, I'm gonna get up and go walk 10 minutes around my house just to get some movement in, because the days go by really quick, and if we're talking to friends, playing games, watching TV, it goes from I'm gonna sit here for 10 minutes to I've been sitting here for 2 hours, and your body gets locked up without you even thinking about it. So setting timers and specific times a day. Yes.
Another alternative is a wife, she won't let me sit for you.
That's for you. If you have friends that are hard on you, they will help. And then keeping your assistive devices in every floor. Again, if that's something that you use for safety, making sure you have if you only live on one floor, but making sure you have other devices in each room of your house to make sure you have something that if you're having a bad day, if you feel like your knee catches, anything like that. So making sure that you're safe. If you live on multiple levels, having something on the bottom floor and the top floor, just so that you're not having to lug it upstairs. And if you are needing to do stuff around your bedroom upstairs, but you don't have your cane, it's in the basement, you have that access up there to make sure that you're safe in using it. And then develop a routine. Going back to being proactive is everything is intentional, and it's all about just staying consistent with whatever you choose to do with your life or with your care and with your pain, is setting up a routine. It doesn't have to be a big shift, but just even that 5 minutes in the morning to do some stretches, do some breathing, and go about your day just like you were doing before. You will see that change as you start to implement a little bit more of that care into the morning or into the night if you have a really difficult time sleeping. Everything's about consistency. So there's no special pill, there's no special treatment that will fix everything. Something will be effective for some time, but if you're not consistent with it, we'll start to see things come back. So it's all about routine and consistency. Any questions about this?
Any advice on how to remember where I left my cane?
No. We do have a patient who uses, there's bells and air tags for canes now. So do you have a phone?
Yes.
Okay. On your phone, you can put an air tag on your cane and it'll tell you exactly where it is in the house. But I don't know how to help you.
My wife did that with me.
Put an air tag?
Air tag for the phone.
Yeah.
No, I remember where I left my phone.
If you lose your phone and your cane, then it's just going around until you find it. Okay, so one thing that we're going to go back to real quick before we get into the learning lab is just a better idea of some things to do. So this is part of our clinic. I don't know if I can make that bigger, but we do aquatic care and land-based PT. So we have an underwater treadmill to help walking. So if you're bearing weight on all your joints when you're walking on land, when you're walking at this height in water, you're only about 50% to 30% weight bearing. We do a lot of suspension for low back, upper body strengthening, cervical strengthening, hip strengthening, all underneath the water to help offload the pressure on your joints and get people back to being able to tolerate land-based care. We do land-based treatment as well, and we always want you to be in the gym by you're discharged with us, because what we're trying to do is get you into the pool, get that body moving, help reduce the pain, and then get you back on land to be able to tolerate what you need to do in your day-to-day. So these are, I know that when people come to us, they don't really know what to expect for aquatic therapy. So this is kind of just an overview of, it's a big above ground pool, and we see through the glass and kind of take you through your treatments and your care. But we also do balance and normal traditional therapy as well. Okay? All right.
Does insurance cover this?
Yes. Insurance covers, just Medicare covers it. Yep. It just depends on, am I having to, I think I have to click that one. It just depends on your insurance. Medicare covers it. You just need a referral to come to PT for Medicare. And then other commercial insurances, you just call and we will call your insurance and see what they cover for you. Okay?
Are there videos that you can access on your phone explaining which exercises to use in the water? In other words, they broke that down to in other words, if you're focusing on one particular part of your body, which exercises?
Yes, so we will, there's no, you asked for a phone. There's no phone or video. There's probably some on YouTube that you can go look at if you have access to a pool and look into it on YouTube. But if you're really concerned about a certain area or body part, coming to a physical therapist so they can see what's going on with your knee or whatever area you're trying to get care for, and then developing a personalized plan from there and giving you the home exercises. A lot of our patients will end up going to Health Tracks. UNC Rex has some aquatic physical therapy pools after they discharge from us, because those places don't have a physical therapist to help you through it. So we educate you, teach you everything, take you through some sessions to see what's effective, and then we'll help you find an aquatic facility to utilize whenever you want, where it's free, you don't have to go to it through insurance, you can go whenever works for you throughout your day. Okay. Yeah?
Exercises?
Yeah.
Okay, I'm gonna pull those up.
Perfect. Any other questions while she's pulling that up? Good, beautiful. Okay, so the first on your guys' sheet for home exercises, I tried to give a little bit more functional exercises just for some, since I knew that you guys were all here for fall assessment and balance, lower body strengthening and exercises. And you might already be doing these exercises with your classes here. So this is just kind of a refresher. It's a visual aid and a description to take home and utilize at your house as you need, okay? The first one is diaphragmatic breathing. So has anyone ever tried belly breathing or diaphragm breathing before? No? Okay, so you can do it laying down on your back, sitting up in a chair, which we'll all do right now, or standing. I do it driving when I get really mad at people, and it helps calm me down so I don't have road rage. I do it when I'm in a store, standing if I feel overwhelmed. I even did it before I came here because talking in front of people makes me nervous, helps calm down my nervous system so I can do what I need to do.
It works because we never know.
Thank you, that makes me feel better. Okay, so sitting up in a chair. When we're breathing, your lungs are like a big box. So you have the top of the box here, the bottom of the box is your diaphragm, and then you have your front of the chest and the back of the chest. They all move when you're breathing. Good job. So when we breathe, normally a lot of us, when we're stressed, when we're really anxious, when we're not thinking about taking a nice deep breath, we breathe up here with our accessory muscles. So your neck and your upper chest. When you are breathing, when you're stressed, it's a lot of short breaths. Usually the shoulders go up, neck goes in, everything stays tight. That doesn't allow for proper oxygenation to come in. So when you're breathing, it's short little breaths, not enough oxygen is getting into your lungs, and that means not enough oxygen is getting to the nerves and to the tissue and to the bone to help them heal and recover. So what we try to do is promote belly breathing or diaphragmatic breathing, where you're breathing down low into your chest, allowing oxygen to circle through your lungs, get out to your nervous system and to your muscles properly, and then you exhale all of the carbon dioxide. That way it allows for proper tissue healing and inflammation reduction.
Does that lead to global warming?
Global healing. I don't know about global warming though. Okay, so what you do, a good way to kind of help yourself, because a lot of us don't even know we do it, is you put one hand on your chest and one hand on your belly. All you do is you try to take a nice deep breath in to the count of 4, and you want to make sure that your chest hand is not moving. So you take a nice deep breath in, and you want your belly hand to move out first, nice and slow, and you try to hold it, and then you come back in nice and slow. There's a special count we'll do, but I just want you guys to try to practice breathing through your belly and not your chest, because what you'll notice is as you take a deep breath in, a lot of your chest, a good amount of your chest are moving like this, where your chest is moving first, and then the belly's following, trying to push out. So it takes practice. It's okay if you don't get it today, don't get frustrated. That's why I gave you these exercises to go home with. So you're just trying to think about taking a nice deep breath like you're smelling roses. You're really trying to smell those roses for a good 4 count, and then try to take a pause so that your body can oxygenate what's in your lungs for about 2 seconds, and then you breathe back out and calm down. Okay, it does take training. That's why we teach it in physical therapy. It is easier to perform on your back. So if you're laying down in bed, you'll notice that you can activate your diaphragm or your belly better than you can sitting. When you're sitting up, gravity's pushing on your lungs, it makes it harder. So they're working against resistance. When you're laying down, the way that you lay down, your lungs aren't going against gravity, so they work a little bit easier. Okay? When you do belly breathing, you want to make sure that you're doing it nice and slow. So usually it would be to a count of 4. So 1, 2, 3, 4. Then you would hold it for 1, 2, 3, 4. And then you breathe out. 1, 2, 3, 4. And then you actually don't breathe for 4 seconds. 1, 2, 3, 4. That 4-second pause at the end of your inhale and exhale allows for oxygen to get into your system. Because if you're going too fast and breathing too fast, if you're hyperventilating or having shallow breathing, you're not allowing time for oxygen to filter through your nervous system, your bloods, and your tissue and your bone. So those pauses allow for more time for that to occur within your body.
Does this help with snoring or sleep apnea?
It helps with the oxygenation of your body. So throughout your day, you'll feel a little bit lighter. You might feel more relaxed. You would have to talk to your doctor about sleep apnea. Some of our patients use it for sleep dysfunction, but I couldn't tell you that it helps with sleep apnea. You would have to talk to your doctor and see, especially if you have a CPAP machine, you don't want to just go off your CPAP machine and start trying to use this. This is more for regulating your nervous system when you're awake. Because when you're asleep, you're not going to be able to do the counts, you're not going to be able to know what's moving. So that's always good to keep using your CPAP machine. So that's belly breathing. As you can see, I put this one laying down so that you can remember it, but lying on your back, place one hand on your chest and one hand on your belly. Try to take a deep breath in so that this belly hand is moving first for the count of 4. Hold the belly breath for 4 seconds, then slowly exhale for 4 seconds. And then try it again. If this is something you're interested in, you guys can try it. Come to a physical therapist and we can try it, or you guys can try it in your sessions if it's something that you want to trial more under the care of your physical therapist here too.
My wife can't sleep very well. Would it do any good if she practices breathing like this? Would that help her when she's asleep and can't practice it, but would develop a habit where maybe she'll sleep better?
Yeah, that's actually a really good question. Diaphragmatic breath can be used at any time. So there's no set protocol of you can only do it once a day. A lot of my patients that have difficulty falling asleep or staying asleep, if they have to get up and go to the bathroom and then they come back to bed and they feel that they're so awake, they can't go back to sleep, I'll have them try a cycle or a couple cycles of belly breathing to help calm them back down. So yes, we do use this to help calm your system down to get you to sleep, but while you're sleeping, if you need a CPAP machine, still use the CPAP machine. Okay, and then let me move this down. So that is belly breathing. And if you have any other questions about it, I'm happy to stay after and talk to you guys individually. So some of these, and you can tell me if you already do them with your current classes, is if you're sitting in a chair for a long time, instead of just trying to stand up right away without moving, a lot of us feel really crickety and stiff and you can't move and a lot more pain. Doing some knee extension, leg kicks, whatever works best for you, whatever with calling it, you're thinking about tightening your thigh, straightening your leg, and then coming back down. You do about 10 to 20. She's even doing ankle circles, which is great, and that's perfect. Anything to get all of your lower joints moving before you stand up. Because again, they're asleep. If you try to stand up on them, they're gonna scream at you. So you wanna make sure that you're promoting muscle activation, blood flow, and moving the joint before you stand up on it. So knee extension kicks. Ball squeezes. So a lot of times if you want to put a towel, a pillow, if you're sitting on a couch and you need to throw a blanket between your legs, anything like that, squeezing your legs together helps to strengthen your inner thighs, your pelvic floor, and make sure that your hips are supported from within. A lot of times we strengthen our outer hips, we don't think about what's going on between our thighs. So this helps to get some blood flow to your inner thigh muscles and your pelvic floor to strengthen and support your pelvis from below before you put weight on it by standing up. Same thing, we still want to strengthen the outside of our legs. So sitting in that chair, bringing your legs out, holding it at the end range and coming back in. This is also really good for hip mobility. So if you feel like you have really stiff hips and they don't move, pushing it out to the side and then coming back in. You can use a band if you have one and if it's recommended for you, just to add resistance to make it harder. And again, all of these right on the side over here, it says you're doing about 10 times, 2 to 3 sets, just to warm up the joints, warm up the muscles. And then we try to stand. And if you're trying this at home under no supervision, there's the big point here of use your hands or use your thighs as you need. Do it in front of a wall, do it in front of your assisted device, anything that you could grab onto if you feel like you're gonna buckle. But I imagine that you guys are working on sit to stands in your classes as well. Perfect. So this is just something to try to incorporate before you stand up. Try to move your body around, straighten your knees, get your inner thighs moving, get your hip moving before you try to stand up. And you might see that you can do it with less strain, you can do it with more mobility, and you actually might feel better doing it once you wake up your body before you stand on it. All right, and then the last few are just some strength and balance. So standing in front of a chair, a railing, a counter, anything that is supportive, you can stand and do some marches just to get a little bit of hip strengthening activation. Helps to make sure that when you're walking, you're picking up those legs. So if you feel like you shuffle a lot or you trip a lot, doing these standing marches can help strengthen your hip flexors to pick up those legs when you're walking and make sure that you're clearing whatever you need to on the surface. A lot of times it just comes from weakness of the hip, so we want to make sure we're strengthening it. You want to do it with support because you are standing on one leg. So that is working the balance and stability. So when you're doing it, just try to make sure that your trunk isn't moving like this. It's staying nice and stable as you do it. And again, this is likely what you guys do in your exercise class as well. Same thing with this one, with lateral kicks, standing, holding on to something, you're kicking out and coming back in. Your outer hip helps to stabilize your pelvis. So as we strengthen this muscle out here, it helps to make sure you don't feel like you're limping or cockeyed when you walk. So it's strengthening those hips. And again, you're standing on one leg, so you're standing up nice and tall, working on stability and balance of those lower leg joints. All right, and then the last one is just standing balance. So as you can see here, she's in a corner for safety. So if you were to, again, try this at home without supervision, you want to make sure you back yourself into a corner, put a chair in front of you, or your rollator, something stable so that you're protected on all sides, and you can try to just stand up nice and tall, stand through your legs. Think about trying to ground your head into the ceiling so that you're lengthening yourself, to just try to work on that stability for when you're cooking at the counter, brushing your teeth, washing your hair, doing your makeup, putting on your earrings. A lot of us, when we're doing something else, we forget what's going on in our body and we just move without thinking, and that's when a lot of falls can happen as well, is because you're not focusing on what's going on in your body, you're focusing on the task at hand. So this is a good way to help train that, is just by practicing standing in space. You can try to put one foot slightly in front of the other and slightly behind to help work on changing pressures in your legs. But the only way to get better at not falling, or to get better at being aware of when you lose your balance, is by practicing. But you want to make sure you do it safely with walls and chairs for support, okay? And again, I would imagine this is also what you guys are doing today. Okay, but all of these will help to strengthen your muscles and your joints to help you support any kind of arthritic pain you might be feeling. All right.
So even though we do them in class, you can, all of these that she just showed, take the paper home, do them at home too.
Yes. Yeah, it's your homework.
Do your homework.
All right. And that's the end of our presentation. But thank you for taking the time to come listen to me today. I appreciate it. Very much so. If anyone has questions, just let me know.